Do you know someone who has trouble learning, gets very anxious in crowds, or flaps their hands when excited? These behaviors can sometimes be part of a rare condition called Fragile X syndrome. It mostly affects kids and can make school or social life harder. But here's the good thing: when families understand early, they can help the child grow stronger. Fragile X is the most common cause of inherited learning issues. So, if a child is slower to talk or gets overwhelmed easily, it might not just be a phase. It could be something like Fragile X. Have you ever wondered why some children act differently? Let's explore this together. So what causes Fragile X syndrome? Think of your body like a big instruction manual made of DNA. A tiny part of this manual is called the FMR1 gene. In Fragile X, this gene has a typo. It repeats too many times, like copying the same sentence over and over in a book. Because of this, the body can't make a special protein called FMRP that the brain needs to learn and grow. No protein, no smooth brain wiring. And this typo is passed from parent to child, usually from mom. For example, if a mother carries the permutation, a smaller typo, her child might get the full mutation. So, it's like passing down a glitch in software that affects how the brain runs. Did you know you can carry this gene and not even know it? Now, what does Fragile X actually look like in daily life? Imagine a 5-year-old who avoids eye contact, jumps at loud noises, and lines up toys perfectly, not because they are picky, but because their brain processes things differently. These kids might talk late, have ADHD-like energy, or tiptoe when they walk. Boys usually show stronger signs than girls. Some may have big ears, a long face, or flat feet, small clues doctors notice. But the biggest signs are social. They might hug too hard, not understand personal space, or panic in busy places like malls. Have you seen a child cover their ears in a noisy room? That could be sensory overload, common in Fragile X. Emotions can be intense, happy 1 second, crying the next. It is not bad behavior, it is their brain trying to cope. How do doctors find out if it's Fragile X? There's only one sure way: a blood test that checks the child's DNA for the FMR1 gene error. It's like reading the instruction manual to find the typo. If a child is slow to talk or has autism-like signs, doctors suggest this test. No X-ray or brain scan can see it, only genetics. Once confirmed, treatment isn't about a cure but support. For example, speech therapy helps them talk better, and occupational therapy teaches how to handle textures, like not hating scratchy clothes. Special education plans let them learn at their pace. Medicines can help with anxiety or hyperactivity, like a seatbelt for a bumpy ride. And families join support groups, because sharing tips with others who get it makes a huge difference. Would you know where to start if your child needed help like this? Can we stop Fragile X before it starts? Well, we can't change DNA yet, but we can make smart choices. If a woman knows she carries the Fragile X gene from family history or testing, she can talk to a genetic counselor. It's like checking the weather before a trip. You prepare. During pregnancy, tests like amniocentesis can tell if the baby has the full mutation. Some families decide based on that. But even if a child has Fragile X, early help, like therapy before age 3, can improve their life drastically. So prevention isn't just about stopping it, it's about catching it early. If you knew your family had this gene, would you want to find out before having kids? Scientists aren't giving up. Right now, they're testing new medicines that aim to fix the brain's chemical balance caused by missing FMRP. Imagine a pill that helps the brain learn better. That's the goal. Some trials use drugs first made for autism or epilepsy, tweaking them for Fragile X. Gene therapy is still far off, but researchers are learning how to turn on healthy genes. Also, apps and devices now help kids with Fragile X communicate using pictures or sounds. One example, a tablet that lights up when the child is stressed, helping caregivers respond faster. Exciting, yes. And families around the world join these studies. Their stories drive progress. Could your voice or experience help find a breakthrough someday?